this webinar the last couple of years, and the talks have been great so far. Very exciting. So there's some overlap in what I'm gonna present with some of the talks that have been presented already, but obviously the focus will be more on prosthetic care. The only disclosures I have is that I'm an employee of UCSF, and that this talk is largely based upon the work of a friend and colleague of mine, Michelle Hall, and her colleagues at Gillette Children's Specialty Healthcare in Minneapolis, St. Paul, Minnesota. And this is the article that I'll be referencing. So I'm just going to talk about congenital limb differences versus acquired. Prosthetic nomenclature, we'll go over that a little bit. I think many of you are aware of the basics of prosthetic care, so I won't spend too much time on that. Activity-specific prostheses, surgical considerations, some of which Dr. Mayer just presented, and upper and lower limb prosthetic milestones, as well as growth and prosthetic replacement. With regard to congenital limb differences, the incidence of an upper limb congenital difference is 2 to 3 times greater than that of a lower limb, with amniotic band syndrome being the most common etiology. Just advance my slide here. Sorry. There we go. A congenital transverse partial absence of the upper third of the forearm is actually the most common upper limb deficiency, while longitudinal deficiencies of the upper limb occur less often.